still today, I go out to dinner or go to the grocery store and people stop me like, you were there when my baby was born. And it's such a good feeling to get to be a part of somebody's life like that. I love that I can go places and know people, and that I can touch the lives of people that I'm going to see again.
I live in a very compassionate community. They care about each other, they look out for each other, and that's important for me because I wanted to raise my kids in a community that people cared about.
Helena's awesome. The sense of community here is really strong. The level of volunteerism is really high. And there's just a general sense of collaboration, working together, supporting each other.
We have to be cognizant and recognizing needs and issues of really about everybody. And then how can we figure out how to help? So the more we're involved and invested in the community, the better St. Peter's Health will be.
At St. Peter's Health, I think we have an obligation to the community to understand the health of the community, not just within the context of the hospital bed or within the hospital walls, but there are so many other factors that impact people's health. So we are intentionally collaborating and working with partners throughout the community to be able to do that, to be at the table, to bring experts together and talk about some of the needs that we have here to improve the health and well-being of everyone in the community.
And to say, you know what, you're really good at that, why don't you do that part? And we're really good at this, so why don't we do this part? What can we do to help you guys? What can you guys do to help us? We all have to pitch in to help each other, and that will make it so that we live in a safe and healthy community.
You know, there's a lot of ways that you could tie the success of a hospital in a community to kind of being a building block of the community. You look at St. Peter's Hospital, not only from a standpoint of providing jobs for people, but providing livelihoods for families within that community. You look at their involvement within the community, whether it's volunteering at different organizations around town, or their support of the businesses within town is hard to quantify at times, but it's real.
Good nutrition is part of a good community, a healthy community. As if you don't have people who aren't eating well, who don't have access to food, it's hard to have a good community. So the partnership between St. Peter's Health and Helena Food Share is just really one component of helping to make the Helena area a better, healthier, all-around community.
Well, obviously, one of our most important partnerships is with St. Peter's Health, and that's a partnership that has existed for over 55 years. For our students to have the opportunity to learn from, network with members of the St. Peter's clinical team, their nurses, their doctors.
The partnership that's always been strong between St. Peter's Health and Carroll, but now we're building a healthy village, a state-of-the-art clinic on their campus that will serve the community on the west side of town, all the students and faculty. And it'll also be a center of learning for the new nurses and physicians and social workers and physical therapists right there on that campus, learning firsthand state-of-the-art health care.
By building a clinic on this campus, it's a partnership that is very important to the future of this community, the future of Carroll College, and the future of St. Peter's Health.
You know, you want to build a community where people stay here and can get their services here. When people have to start leaving the community to get healthcare services, then the rest of the community suffers. So it only behooves all of us to build a system where our community wants to stay here for their services.
We don't have all the answers at St. Pete's. We don't pretend to have all the answers. But what we want to be able to do is we want to be a connector. We want to be able to bring people together, to be a collaborator, to come together to discuss different ideas and concepts, concerns that the community has, and then work collaboratively to come up with solutions.
And so that's a sign of partnership. There are new coalitions in the community between the many wonderful nonprofits that are here that are battling mental health or childhood abuse or early childhood development or homelessness. That includes the city and the police department, providers, all of whom touch these populations, all of whom have been there for many years, working, doing the best they can. There's now this feeling of we can do better if we work together.
And there are lots of community organizations where people have expertise that we don't have. And we want to be able to engage with them and support them and help them as we work together to improve the health and well-being of our community.
There's just so many ways that people can give in this community, and it's not just about money.
When we were at St. Peter's Hospital doing the bedwing expansion, and when I had to go into meetings inside the hospital was past the oncology department, I would always walk in with my hard hat under my arm. And there was a little boy that was making visits to the oncology department. And one day his mother stopped me and said, "My son would like to give you something." I'm like, "Okay." And he handed me a Bob the Builder sticker because he believed I was Bob the Builder. And he looked forward to that every day when he was going to his appointments at the oncology department. So you want to talk about something that's very touching and very meaningful to me. That's the epitome of it. I still have that sticker on my hard hat, actually. So, yeah.